My mother was a 2-time breast cancer survivor. Unfortunately, she lost her battle with ovarian cancer. She had always made us very self-aware of our bodies and, always do your breast exams because with the family history, you never know when it can affect you. So I always did them. I was 30 when I was first diagnosed. I can remember doing a self-breast exam in the shower. No reason really why, and I felt a small pea-sized nodule in my right breast. We had just finished doing a memory stone for Nick, my son, May 25th, 1998. I can remember going into Dr. Haggerty's office in tears.
And Tina comes in, you have to address what's in front of you. So you got a 30-year-old woman who has right-sided breast cancer. You try to do what you feel is appropriate at that time, thinking of cure.
It was pretty much a roller coaster, a lot of ups and downs, and a young couple with a young son, and all of a sudden your wife has cancer, and you start thinking about, all the possibilities and how you're gonna raise your son if your wife's not there to help you and things like that. So it was very scary. I didn't know. All I could think of was how my son was gonna get through life if his mom wasn't here.
Well, I think about it a lot, actually, and like those times when you get in arguments with your parents, you just have to think about it and be like, I just need to stop this, because so what if you're arguing, it could have never happened, and you could never even have said 2 words to her, and it just think about it a lot.
They sent me to Dr. Haggerty, recommended Dr. Haggerty as an oncologist. I went and saw him, told me exactly what was going to happen, put it in words that I could understand, both me and my husband. Had the surgery, recouped very well, and started chemotherapy within, I believe it was within a month. 4 years after I went through chemotherapy for my first battle with breast cancer, I was diagnosed for a second time in the opposite breast.
4 years later, she developed, again, something she felt. She palpated her second cancer on the left side.
There were actually 2 masses in that breast at that time. I had several surgeries over the next probably 14 months at Shady Grove Adventist Hospital. They were great. The nurses took very good care of me. They even had somebody coming in asking if I wanted to go to a support group, that there were support groups available for cancer survivors if I needed, any kind of help like that.
I do consider Tina cancer-free. A term that I like to use in oncology is NED, no evidence of disease. And that's a very strong oncology term.
I'm in a good place right now. I've been able to watch my son grow up. That has been my main goal. I'm happily married. I just did everything I could to be there for my son.
Like, what would you do without your mom? I mean, when nobody else is there for you, she's there. I really just can't imagine life without her.